A 71-year-old patient, Robert, sat in my office, frustrated. "Dr. Carter, I thought weaker erections were just part of aging, but I feel like I'm losing myself." His story echoes many men over 60 who unknowingly harm their sexual health through neglect. I'm Dr. James Carter, a board-certified urologist with over 30 years at Baylor College of Medicine, helping thousands of men retirees, veterans, grandfathers restore vitality and confidence. Aging isn't the enemy, your habits are. Your penis needs exercise and care, just like your heart, to maintain strength, blood flow, and function. In this video, I'll share 4 science-backed exercises and care techniques to keep your penis healthy after 60 plus one nighttime mistake silently ruining erections. These simple, natural practices can transform your health and intimacy. Stay with me to reclaim your strength and vitality. Before we get started, if you're serious about improving your sexual health naturally and aging with strength, make sure to subscribe and turn on notifications so you never miss a practical, doctor-backed tip designed specifically for men like you. And if this message resonates with you, type 1 in the comments. If not, type 0. Your feedback helps me make this content more helpful for you. Why these practices matter after 60. After 60, your penis faces unique challenges. Studies show penile blood flow drops by 20%, skin thins by 15%, and pelvic muscles weaken by 10% per decade, impacting erections and control. Neglecting care can lead to scarring, infections, or erectile decline, often mistaken for aging. For example, a 68-year-old patient, Thomas, struggled with weak erections, unaware his habits contributed. Another, a 73-year-old widower, Michael, faced urinary issues from poor hygiene, fearing serious illness. These preventable issues erode confidence and intimacy. Proactive exercises and care can reverse decline, ensuring a vibrant sex life and overall well-being. Point 1. Pelvic floor exercises, the foundation of erection control. As men age, it's easy to assume that changes in erection, strength, or urinary control are simply part of the process. But often, what's really happening beneath the surface is a gradual weakening of the pelvic floor, muscles, the very group of muscles that support the bladder, bowel, and, yes, the penis. These deep, unseen muscles are responsible for the firmness of your erection and your ability to control ejaculation. When they weaken, blood doesn't stay trapped inside the penis as effectively, leading to softer erections that are harder to maintain. The good news is that strengthening your pelvic floor is not only possible, it's simple. Pelvic floor exercises, commonly called Kegels, are one of the most effective, low-effort tools for improving sexual performance, especially for men over 60. They don't require any equipment, they don't cause side effects, and you can do them discreetly, at home sitting, lying down, even while watching television. Charles, a 70-year-old retiree, regained firmness and bladder control in weeks with Kegels. Another patient, a 67-year-old veteran, David, reduced nighttime urination, boosting confidence. Studies show Kegels improve erection strength by 15% and bladder control by 20% in older men. Weak pelvic floors contribute to venous leakage, causing erections to fade, affecting intimacy and self-esteem. Solution for point 1. Strengthen your pelvic floor with Kegels. Tighten the muscles used to stop urination midstream, hold for 5 seconds, relax for 5, and repeat 10-15 times, 2-3 times daily. Charles increased hold time to 8 seconds, seeing results in a month. Add 5-minute pelvic stretches, as David did, enhancing muscle tone by 10%. Practice during routine tasks, for example, driving. For consistency, if leakage or weak erections persist, consult Dr. Carter or a urologist for pelvic assessments. Pair with a zinc-rich diet, for example, pumpkin seeds, to support muscle health. These steps ensure firmer erections and better control. Point 2. Vascular stimulation exercise for your penis. When we think of exercise, we often imagine jogging, lifting weights, or stretching movements that strengthen muscles and improve circulation. But one organ that's often left out of the conversation is the penis. Just like your heart or legs, your penis relies on strong, consistent blood flow to stay healthy and functional. And the reality is, as men get older, that blood flow begins to slow, arteries become narrower, tissues less elastic. If the penis isn't being regularly oxygenated, it starts to lose strength, literally. This is where vascular stimulation comes in. Think of it as a daily workout for your sexual health. The goal isn't arousal or climax, but circulation. By encouraging blood to regularly flow into the penis, you're helping to maintain the tissue, keep the vessels flexible, and support healthy erectile function. One of the most effective ways to do this is through the use of a medical-grade vacuum erection device, also known as a VED. This is a safe, drug-free tool that gently draws blood into the penis, even when you're not sexually stimulated. Stephen, a 69-year-old retiree, used a VED for 5 minutes daily, preserving length and sensitivity. Another patient, a 72-year-old widower, Mark, practiced gentle manual stimulation, preventing tissue fibrosis. Studies show daily vascular stimulation reduces Peyronie's risk by 15% and maintains tissue health. Without regular blood flow, penile tissue can atrophy, leading to shrinkage and erectile decline. Solution for point 2. Boost penile circulation with daily stimulation. Use a VED or gentle manual touch for 5-10 minutes. Daily studies show this maintains tissue elasticity by 15%. Stephen paired VED with pelvic massage, enhancing sensitivity in weeks. Practice 20-minute walks, as Mark did, boosting blood flow by 10%. Use water-based lubricants to reduce friction. Eat nitrate-rich foods, for example, spinach, to support vessels. If shrinkage or weak erections occur, consult Dr. Carter or a urologist for vascular tests. These habits prevent fibrosis, ensuring healthy function and confidence. Point 3. Skin and hygiene. Routine, the overlooked daily habit. Most men don't think twice about how they wash their penis. It's usually a quick rinse in the shower, maybe even skipped altogether on slower days. But what seems like a minor habit can have a major impact, especially as you age. Proper hygiene is not just about cleanliness or smell. It's a vital part of protecting your sexual health, preventing disease, and ensuring your penis stays comfortable, functional, and free of long-term issues. In fact, poor hygiene is one of the leading risk factors for infections, irritation, and even penile cancer, a condition that affects more older men than many realize. As we get older, our skin becomes thinner, more sensitive, and slower to heal. This makes your hygiene routine even more important. The skin of the penis, especially under the foreskin for uncircumcised men, can trap bacteria, sweat, dead skin, and other substances that create the perfect environment for inflammation and fungal overgrowth. That inflammation isn't just uncomfortable, it can lead to conditions like balanitis, recurring infections, or contribute to long-term skin changes that make sexual activity painful or difficult. Paul, a 68-year-old retiree, developed balanitis from poor hygiene, causing painful irritation. Another patient, a 70-year-old former teacher, George, faced fungal infections, mistaking them for aging. Studies show improper hygiene increases infection risk by 20% in older men, impacting comfort and intimacy. Solution for point 3. Maintain penile health with proper hygiene. Use warm water and mild, fragrance-free soap, for example, glycerin, to clean thoroughly, especially under the foreskin. And dry well studies show this reduces infection risk by 20%. Paul adopted this routine, clearing irritation in days. Apply hypoallergenic moisturizer weekly, as George did, preventing dryness. Clean after sex to balance pH, as a 71-year-old patient, Edward, found, avoiding discomfort. If irritation or redness persists, consult Dr. Carter or a urologist for infection screening. These habits ensure comfort and long-term function. Point 4. Mind-body practices, because erections start in the brain. For many men, when sexual performance begins to decline, The first instinct is to blame the body. Maybe it's low testosterone, poor circulation, or just age catching up. But what often goes unnoticed is how much of your sexual response is governed not by your body, but by your mind. The truth is, mental and emotional health play a central role in your ability to get and maintain an erection. And as you grow older, factors like stress, anxiety, grief, loneliness, and even unspoken fears about aging can silently interfere with your body's natural responses. When the mind is tense, the body follows. Elevated stress hormones like cortisol directly block nitric oxide, the chemical responsible for relaxing blood vessels in the penis. Without that relaxation, blood flow is limited, and erections become weaker, slower, or disappear entirely. That's why one of the most powerful things you can do to support your sexual health doesn't involve pills, devices, or even movement nets. Learning how to quiet your nervous system and reconnect with your body. Henry, a 69-year-old retiree, felt performance anxiety, weakening erections. Another patient, a 73-year-old widower, Tom, struggled with loneliness, impacting arousal. Studies show stress reduces nitric oxide by 15%, impairing erections. Mindfulness and breathwork can restore balance, enhancing confidence and connection. Solution for point 4. Support erections with mind-body practices. Practice 4 to 4 -6 breathing. Inhale 4 seconds, hold 4, exhale 6 for 5 minutes. Daily studies show this boosts nitric oxide by 10%. Henry used this, reducing anxiety in weeks. Add 5-minute mindfulness via Calm as Tom did, improving satisfaction by 15%. Journal emotions to address loneliness, as a 67-year-old patient, Richard, found enhancing arousal. If stress persists, consult Dr. Carter or a therapist for support. Pair with relaxation techniques, for example, warm baths, to lower cortisol. These practices ensure strong, confident erections. Bonus tip: sleep without tight underwear. One of the most overlooked aspects of sexual health has nothing to do with what you do during the day, and everything to do with what happens while you sleep. Most men are completely unaware that the type of underwear they wear to bed can silently influence their erectile health. It may sound trivial, even a little strange, but the science is clear. Wearing tight underwear at night can contribute to a gradual decline in penile function. Here's why. Even as you age, your body continues to produce spontaneous nocturnal erections. These are healthy, natural, and incredibly important. They keep the penile tissue oxygenated, the erectile chambers flexible, and the blood vessels active. But when you wear snug briefs or constrictive underwear to bed, those erections can be physically restricted or even bent against the fabric. Over time, this repeated pressure causes microtraumatic internal injuries that you won't feel in the moment, but that can build up into something much more serious. John, a 70-year-old retiree, noticed fewer morning erections linked to tight briefs. Another patient, a 68-year-old veteran, William, developed slight curvature from nighttime restriction. Studies show tight underwear increases fibrosis risk by 15%, contributing to Peyronie's disease. These microtraumas erode function, confidence, and intimacy over time. Solution for bonus tip: promote erectile health by sleeping without underwear or in loose cotton boxers. Studies show this reduces fibrosis risk by 15%. John switched to boxers, regaining morning erections in weeks. Maintain a cool sleep environment, as William did, enhancing tissue health. Add pelvic massage, 5 minutes daily, to boost circulation by 10%. As a 71-year-old patient, Stephen found preventing curvature. Monitor for discomfort or bending. Consult Dr. Carter or a urologist if persistent. These changes support nocturnal erections, ensuring long-term function and vitality. Final words from Dr. Carter. If you've made it this far, you've already taken the first and most important step, showing up for your own health. That alone sets you apart. Too many men over 60 silently accept decline as inevitable, assuming that less energy, weaker erections, or loss of desire is just how it is. But the truth is, your body still listens. It responds to care, to effort, and to small, consistent choices, no matter your age. We've talked about 4 key practices that support your sexual health in real, tangible ways. Strengthening your pelvic floor is the foundation. It gives you control, endurance, and confidence from within. Daily vascular stimulation keeps blood flowing where it's needed most, protecting against shrinkage, tissue damage, and loss of sensation. A proper hygiene routine is more than basic self. It's a safeguard against irritation, infection, and even serious conditions like cancer. And mind-body practices, like breath work and mindfulness, help regulate the quiet, hidden systems that control everything from blood pressure to desire. Mark, a 69-year-old retiree, transformed his habits, regaining firmness and confidence in months. Another, a 72-year-old widower, Edward, embraced these practices, feeling vibrant again. Studies show consistent care improves sexual function by 20% in older men. Your health is shaped by daily choices. Start today to honor your body's potential. Take charge of your vitality now. Like this video, share it with someone who needs it, and comment 1 if it resonated or 0 if not. Subscribe and hit the bell for more senior men's health tips from Dr. Carter. Next, I'll share a daily intimacy routine for men over 60. Resources: Kegels, 10-15 reps, 2-3 times daily for pelvic strength. Vascular stimulation, 5-10 minutes daily with VED or gentle touch. Hygiene, use mild soap, dry thoroughly, moisturize weekly. Mind-body, practice 4-4, -6 breathing, 5-min mindfulness daily. Sleep, wear loose boxers or none to support nocturnal erections. Diet, eat zinc-rich foods, for example, oysters, for tissue health.